Have you noticed that you leak a little when you laugh, sneeze, or exercise? Do you experience that uncomfortable pressure or heaviness in your pelvic region by the end of the day? Has intimacy become painful or uncomfortable in ways that it wasn't before? If you're nodding along, you're definitely not alone. These symptoms are incredibly common, affecting millions of women worldwide, yet we rarely talk about them openly. These sensations aren't just annoying inconveniences, they're often signs that your pelvic floor muscles might need some attention. The pelvic floor is an amazing group of muscles that forms a hammock-like structure supporting your bladder, uterus, and bowels. When these muscles weaken or become too tight, various uncomfortable symptoms can develop that many women simply accept as normal or just part of aging. But here's something many women don't realize. These issues aren't something you have to live with forever. Research shows that up to 25% of women experience pelvic floor disorders at some point in their lives, with that number jumping to nearly 50% in women over 80. After childbirth, about 1/3 of women experience some form of pelvic floor dysfunction. During menopause, changing hormone levels can further affect these crucial muscles. While these statistics might sound alarming, there's actually incredibly good news. Studies published in journals like Female Pelvic Medicine and Reconstructive Surgery have consistently shown that specific exercises can dramatically improve these symptoms, often without medication or surgery. In fact, a review in the International Urogynecology Journal found that targeted pelvic floor exercise programs led to significant improvement in over 70% of women with mild to moderate symptoms. Today, I'm going to walk you through 5 exercises that have been scientifically proven to support pelvic health. Each one targets different aspects of pelvic floor function, from basic strengthening to coordination with your breathing and daily movements. The beauty of these exercises is that you can do them all at home without any expensive equipment, and they can easily fit into your existing routine. By the end of this video, you'll have a complete toolkit to start strengthening your pelvic floor, relieving symptoms, and preventing future problems. Whether you've recently had a baby, are approaching menopause, or simply want to maintain optimal pelvic health, these exercises can make a real difference in your daily comfort and confidence. So stick around until the end to discover how these 5 simple exercises can transform your pelvic health, and make sure to share this video with other women who might benefit from this information that too often gets overlooked in regular healthcare conversations. Your pelvic health matters, and small changes really can make an enormous difference. Let's start with what many physical therapists consider the foundation of pelvic floor health: Kegel exercises. If you've heard of just one pelvic floor exercise, it's probably this one, but there's a good chance you might not be doing them correctly. These exercises were named after Dr. Arnold Kegel, who pioneered them back in the 1940s to help women with urinary incontinence after childbirth. While they've been around for decades, recent research has refined how we understand and perform them. A 2018 study published in the Journal of Women's Health Physical Therapy found that properly performed Kegel exercises led to a 70% improvement in stress urinary incontinence. That's the leaking that happens when you cough, laugh, or exercise. Another study in the American Journal of Obstetrics and Gynecology showed that women who did regular Kegel exercises experienced significant improvement in both urinary control and sexual function. To understand why Kegels work so well, let's talk about what's actually happening in your body. Your pelvic floor muscles form a supportive hammock that runs from your pubic bone at the front to your tailbone at the back. These muscles support your pelvic organs, help control bladder and bowel function, and play an important role in sexual health. When they weaken due to pregnancy, childbirth, hormonal changes, aging, or chronic straining, those supportive structures can't do their job as effectively. The tricky part about Kegel exercises is that they target muscles you can't see, which makes it challenging to know if you're doing them correctly. So let's break it down into clear steps. First, you need to identify the right muscles. The simplest way to find them is to try stopping the flow of urine midstream. The muscles you squeeze to do this are your pelvic floor muscles. However, it's important to note that this is just for identification. Don't regularly practice Kegels while urinating, as it can actually lead to urinary tract infections or incomplete emptying of the bladder. Another way to identify these muscles is to imagine you're trying to stop passing gas or trying to pull a tampon up inside your body. You should feel a lifting and tightening sensation. What you shouldn't feel is your buttocks, thighs, or abdominal muscles tightening. That's a sign you're recruiting the wrong muscles. For beginners, the best position is lying on your back with knees bent and feet flat on the floor. In this position, Your pelvic floor doesn't have to work against gravity, which makes it easier to isolate the correct muscles. Now for the actual exercise. Start by taking a deep breath in, and as you exhale, gently contract your pelvic floor muscles. Imagine you're lifting and drawing in, like you're picking up a blueberry with your vagina. Hold this contraction for 3 seconds while breathing normally. Don't hold your breath, then completely relax for 5 seconds. That complete relaxation phase is just as important as the contraction. A common mistake is not fully relaxing between contractions or bearing down instead of lifting up. Another is squeezing too hard. You're aiming for about 30% of your maximum effort, not an intense clench. Think gentle elevation, not a forceful grip. Start with 5 repetitions 3 times a day and gradually work up to 10 repetitions, holding each for 5 to 10 seconds. As you get stronger, you can progress to doing them while sitting and eventually while standing, when your pelvic floor has to work against gravity. The benefits of regular Kegel exercises extend beyond just preventing leaks. They can improve bladder control, support your pelvic organs to prevent prolapse, that feeling of heaviness or pressure, and even enhance sexual sensation and function by increasing blood flow to the area and improving muscle tone. A consistent practice is key. Studies show that women who perform Kegels regularly for at least 12 weeks see the most significant improvements. The good news is that you can do them anytime, anywhere, while sitting at a traffic light, standing in line at the grocery store, or watching TV. No one will even know you're exercising these invisible but crucial muscles. One important note: if you experience pain when attempting Kegels or find that your symptoms worsen, it could indicate that your pelvic floor is actually too tight rather than too weak. In this case, relaxation exercises might be more appropriate, and it's worth consulting with a pelvic floor physical therapist for a personalized assessment. Now let's move on to our second exercise approach: yoga poses that support pelvic health. While Kegels target the pelvic floor directly, yoga addresses pelvic health more holistically, working on flexibility, strength, and relaxation of the entire pelvic region and surrounding structures. Yoga's effectiveness for pelvic health isn't just anecdotal. A 2019 study in the International Journal of Yoga Therapy found that women who practice specific yoga poses regularly experience significant improvement in pelvic pain and urinary symptoms. Another study published in Female Pelvic Medicine and Reconstructive Surgery showed that a 12-week yoga program led to improvements comparable to standard pelvic floor physical therapy for certain conditions. What makes yoga particularly effective is that it addresses both the physical and mental aspects of pelvic health. Chronic stress can cause tension in the pelvic floor muscles, just as it does in other parts of the body. The mindful breathing and relaxation components of yoga help release this tension, while the poses themselves create beneficial stretching and strengthening. Let's start with Child's Pose, which gently relaxes the pelvic floor and relieves tension. Begin by kneeling on the floor with your big toes touching and knees spread about hip-width apart. As you exhale, lower your torso between your thighs and extend your arms forward, palms down. Rest your forehead on the floor and breathe deeply for 1 to 3 minutes. This pose creates a gentle stretching sensation in the lower back and inner thighs while allowing the pelvic floor to completely relax. Next is Happy Baby Pose, which opens the hips and promotes relaxation in the pelvic region. Lie on your back and bring your knees toward your chest. Grab the outer edges of your feet with your hands, or hold onto your ankles or shins if that's more comfortable. Open your knees slightly wider than your torso, bringing them up toward your armpits. Flex your feet and gently push your feet into your hands while pulling down with your hands to create resistance. Hold for 30 to 60 seconds while breathing deeply. This pose stretches the inner groin and hamstrings while releasing tension in the lower back and sacrum. Goddess Pose helps strengthen the pelvic floor and improves awareness of these muscles. Stand with your feet wider than hip-width apart and turn your toes outward. Bend your knees deeply, keeping them in line with your toes, and lower into a squat position with your pelvis about 2 feet off the ground. Bring your hands together at your heart or extend your arms out to the sides. Engage your core and pelvic floor slightly as you hold for 30 to 60 seconds. This pose builds strength in the inner thighs and pelvic floor muscles while improving circulation to the entire pelvic region. Bridge Pose strengthens the pelvic floor while improving circulation and mobility. Lie on your back with knees bent and feet flat on the floor, hip-width apart. Place your arms alongside your body with palms down. As you inhale, press into your feet and lift your hips toward the ceiling, engaging your glutes and hamstrings. For extra pelvic floor engagement, imagine drawing your sitting bones toward each other as you lift. Hold for 3 to 5 breaths, then slowly lower back down. Repeat 5 to 8 times. This pose strengthens the entire pelvic support system, including the glutes, lower back, and pelvic floor. Finally, reclining bound angle pose helps release tension in the pelvic floor and promotes relaxation. Lie on your back and bring the soles of your feet together, allowing your knees to fall open to the sides. Place one hand on your heart and one on your belly, and focus on deep, slow breathing for 2 to 5 minutes. This gentle hip opener stretches the inner thighs and groins while allowing the pelvic floor to fully relax. Proper breathing is essential in yoga practice and particularly important for pelvic health. Try to breathe deeply into your belly, allowing it to expand as you inhale and contract as you exhale. This diaphragmatic breathing helps massage your internal organs and promotes proper pressure management in your core and pelvic floor. It's important to note that during pregnancy, some modifications might be necessary. Avoid deep twists and lying flat on your back after the first trimester. If you're postpartum, wait until you've been cleared by your healthcare provider before resuming yoga practice, typically around 6 to 8 weeks after delivery. If you experience pain in any pose, back off immediately. Yoga should create a gentle stretch sensation, but never sharp pain. Start with just 10 to 15 minutes of these poses daily, and you'll likely begin to notice improvements in how your pelvic area feels within a few weeks of consistent practice. Let's move on to our third type of exercise, low-impact aerobic activities. While Kegels and yoga directly target the pelvic floor, aerobic exercise provides broader benefits that significantly impact pelvic health, from hormone balancing to weight management and improved circulation. Research from the Journal of Physical Therapy Science has shown that women who engage in regular low-impact aerobic exercise report fewer pelvic floor symptoms compared to sedentary women. Another study in the British Journal of Sports Medicine found that aerobic activity can reduce the severity of urinary incontinence by up to 70% in some women. Aerobic exercise works through multiple mechanisms to support pelvic health. First, it helps maintain a healthy weight, which reduces pressure on the pelvic floor. Research shows that even a 5 to 10% reduction in body weight can significantly improve urinary incontinence symptoms. Second, aerobic exercise improves circulation throughout the body, including the pelvic region, which promotes tissue health and healing. Third, it helps balance hormone levels, which is particularly beneficial during perimenopause and menopause when declining estrogen can affect pelvic tissue strength and elasticity. Walking is perhaps the most accessible and beneficial low-impact aerobic exercise for pelvic health. A brisk 30-minute walk 5 days a week can make a remarkable difference. The key is to maintain good posture while walking, stand tall with your shoulders relaxed, engage your core slightly but not rigidly, and focus on a heel-to-toe rolling motion with each step. This alignment helps distribute pressure properly through your pelvic floor as you move. Swimming and water aerobics provide excellent cardiovascular benefits while being extremely gentle on the pelvic floor. The buoyancy of water reduces the effects of gravity on your pelvic organs, which can be especially beneficial if you're experiencing heaviness or prolapse symptoms. The water also provides gentle resistance that strengthens your muscles without strain. Aim for 30 minutes of swimming or water aerobics 2 to 3 times a week. Breaststroke in particular can help strengthen the inner thighs, which work synergistically with the pelvic floor. Stationary cycling is another excellent option, but proper seat adjustment is crucial. Your seat should be high enough that your legs are almost fully extended at the bottom of the pedal stroke, with just a slight bend in the knee. This prevents excessive pressure on the perineum. Some women find seats with cutouts or wider designs more comfortable. Start with 15 to 20 minutes and gradually increase to 30 to 45 minutes 3 times per week. The controlled circular motion strengthens the legs and core while improving cardiovascular health without jarring impact. Elliptical training combines the benefits of walking and stair climbing without the impact. The smooth, gliding motion is gentle on your pelvic floor while still providing excellent cardiovascular conditioning. Focus on maintaining good posture rather than leaning on the handrails, which helps engage your core properly. Start with 15 minutes and gradually work up to 30 minutes, 3 to 4 times per week. Low-impact dance forms like Tai Chi or certain styles of ballet-inspired fitness can be wonderful for pelvic health. These activities improve coordination, balance, and body awareness while gently strengthening the core and pelvic floor. The focused, intentional movements help integrate pelvic floor function into whole body movement patterns. Even 20 minutes twice a week can provide noticeable benefits. For all aerobic activities, proper breathing is essential. Avoid holding your breath during exertion, which can increase downward pressure on your pelvic floor. Instead, exhale during moments of effort and inhale during recovery phases. Start at a comfortable intensity where you can still carry on a conversation without getting breathless. This moderate intensity is ideal for hormone balancing and sustainable exercise habits. As your fitness improves, you can gradually increase duration before increasing intensity. One of the most important aspects of aerobic exercise for pelvic health is consistency. 3 10-minute walks provide similar benefits to one 30-minute walk, so don't feel that every session needs to be lengthy. Finding opportunities to move throughout your day can make a substantial difference. Taking the stairs instead of the elevator, parking farther from your destination, or having walking meetings instead of sitting in a conference room. If you're returning to exercise after pregnancy, wait until your healthcare provider has cleared you, typically at your 6-week postpartum check. Start gradually with walking and listen carefully to your body's signals. If you experience leaking, pain, or a feeling of heaviness during or after exercise, it's a sign to modify your activity and potentially consult with a pelvic floor physical therapist. For those with existing pelvic floor conditions like prolapse, focus on horizontal activities like swimming or recumbent cycling, rather than upright activities that place more downward pressure on the pelvic floor. Wearing a supportive garment during exercise can also provide temporary relief while you work on building strength. Remember that the goal is sustainable, enjoyable movement. Finding activities you genuinely look forward to ensures you'll stick with them long-term, providing ongoing benefits for your pelvic and overall health. Now let's explore our 4th exercise approach, Pilates for core pelvic connection. Pilates offers a unique and powerful way to improve pelvic health by focusing on the interconnected nature of your core muscles, which include not just your abdominals, but also your pelvic floor, deep back muscles, and diaphragm. Developed by Joseph Pilates in the early 20th century, this exercise system emphasizes quality of movement over quantity, precise control, and centered awareness, all particularly valuable for pelvic health. Research in the Journal of Clinical Nursing found that women who participated in a Pilates program experienced significant improvements in pelvic floor strength compared to control groups. Another study in the International Urogynecology Journal showed that Pilates training reduced urinary incontinence symptoms by strengthening both the pelvic floor and the surrounding support system. What makes Pilates especially effective is its focus on what's often called the powerhouse, the deep, stabilizing muscles of your core that work together as an integrated unit. Rather than isolating the pelvic floor, Pilates teaches you to coordinate it with breath and movement, which mirrors how these muscles need to function in daily life. Let's start with pelvic tilts, which help develop awareness of your neutral spine position and gentle pelvic floor engagement. Lie on your back with knees bent and feet flat on the floor, hip-width apart. Place your hands on your lower belly or hip bones to feel the movement. Start by gently tilting your pelvis backward, flattening your lower back into the floor, posterior tilt. Then tilt your pelvis forward, creating a small arch in your lower back, anterior tilt. Move slowly between these positions 8 to 10 times, then find the middle ground, your neutral position where there's a slight natural curve in your lower back. In this neutral position, practice gently engaging your pelvic floor as you exhale and releasing as you inhale. This exercise improves your awareness of pelvic positioning and how it affects your pelvic floor. Next is the modified 100, which strengthens your deep abdominals while coordinating them with your pelvic floor and breath. Lie on your back with knees bent at a 90-degree angle, shins parallel to the floor, tabletop position. Gently engage your core by drawing your navel toward your spine and lift your head and shoulders slightly off the floor, extending your arms alongside your body. As you hold this position, take 5 short breaths in through your nose, gently activating your pelvic floor with each inhale, and 5 short breaths out through your mouth, releasing with each exhale, while pumping your arms slightly up and down. Start with 20 counts, 2 complete breath cycles, and build up to 100 counts over time. This exercise builds endurance in your core and pelvic floor while teaching you to maintain engagement during breathing. Side-lying leg lifts target the hip stabilizers that work with your pelvic floor. Lie on your side with your body in a straight line, bottom arm extended under your head, and top arm on the floor in front for support. Ensure your hips are stacked and your waist isn't sagging. Engage your core and pelvic floor gently, then slowly lift your top leg to hip height. keeping it parallel to the floor. Hold briefly at the top, then lower with control. Perform 8 to 12 repetitions on each side. This exercise strengthens the muscles that support your pelvis from the sides, improving overall stability. Clamshells strengthen the external rotators of the hip, which play a key role in pelvic alignment. Lie on your side with knees bent at a 45-degree angle, hips and shoulders stacked. Keep your feet together and maintaining the connection between your feet. Open your top knee like a clamshell, keeping your pelvis stable. Don't let your pelvis roll backward as you open your knee. Return to the starting position with control. Perform 10 to 15 repetitions on each side. This exercise improves hip stability, which reduces strain on the pelvic floor. Modified planks build integrated core strength to support your pelvic floor. Start in a modified plank position with your weight on your knees and forearms, elbows directly under your shoulders. Engage your deep abdominals by drawing your navel toward your spine and gently activate your pelvic floor. Hold this position while breathing normally for 20 to 30 seconds, gradually increasing to 60 seconds as you build strength. Focus on maintaining a long, neutral spine without sagging in the middle or hiking up your hips. This exercise builds endurance in your entire core support system. The mind-body connection is fundamental to Pilates, and this awareness has particular benefits for pelvic health. Throughout these exercises, focus on the sensation of your pelvic floor engaging and releasing. This improved body awareness translates to better control in daily activities and can help you recognize when you're unnecessarily tensing these muscles during the day. For beginners, try incorporating these exercises into a 15 to 20-minute routine 2 to 3 times per week. Quality is far more important than quantity. A few perfectly executed movements will bring better results than many done with poor form. As you progress, you can increase the duration or add more challenging variations. If you're new to Pilates, consider taking a few classes with a qualified instructor who can check your form. Many physical therapists who specialize in pelvic health also offer Pilates-based rehabilitation programs that can be particularly helpful if you're dealing with specific pelvic floor disorders. While Pilates requires minimal equipment, a yoga mat provides cushioning for comfort. If you find it difficult to maintain proper form, props like small pillows or folded towels can provide support until your strength improves. One of the most valuable aspects of Pilates for pelvic health is that it teaches you to maintain proper core activation during movement, rather than just during specific exercises. This translates to better support for your pelvic floor throughout your daily activities, which is where the real-world benefits become apparent. Now let's move to our fifth and final exercise approach, functional movement training. This approach might be the most practical of all because it directly connects pelvic floor function to the everyday movements you naturally perform, creating healthy patterns that support your pelvic health throughout daily life. Research in the Physical Therapy Journal has shown that women who incorporate functional movement training into their routines experience significant improvements in pelvic floor symptoms, particularly during activities that previously triggered problems. A study in the International Journal of Women's Health demonstrated that movement pattern retraining reduced pelvic pain and urinary symptoms by addressing the whole body's role in pelvic function. The foundation of functional movement training is recognizing that your pelvic floor doesn't work in isolation. It's part of an integrated system that includes your deep abdominals, back muscles, diaphragm, and hip muscles. When these systems work together properly, they distribute pressure and load efficiently throughout your body, protecting your pelvic floor from excessive strain. Let's start with proper squatting technique, which is essential for everyday movements like sitting down, picking things up, or lifting children. Stand with feet hip-width apart or slightly wider, toes pointing slightly outward. Initiate the movement by hinging at your hips, sending them backward as if you're about to sit in a chair. Lower until your thighs are parallel to the ground, or as far as is comfortable with good form. Keep your chest lifted, your spine in its natural curve, and your knees tracking over your second and third toes. As you lower, focus on creating a gentle engagement of your pelvic floor and deep abdominals. As you rise, exhale and think of your pelvic floor lifting as your body lifts. Practice 8 to 12 repetitions, focusing on quality of movement rather than depth. This movement pattern trains your pelvic floor to activate appropriately during lifting tasks, which can prevent stress incontinence and excessive pelvic loading. Lunges with pelvic awareness improve stability during asymmetrical movements like climbing stairs or getting into a car. Start standing with feet hip-width apart. Step 1 foot forward about 2 to 3 feet and lower your back knee toward the floor, creating two 90-degree angles with your legs. Your front knee should align over your ankle, not pushing forward beyond your toes. Maintain a tall spine and engage your core gently throughout the movement. Pay attention to keeping your pelvis level. Don't let it rotate or tilt to one side. As you push back to standing, exhale and engage your pelvic floor. Perform 8 to 10 repetitions on each side. This exercise improves single leg stability and teaches pelvic control during asymmetrical loading. Functional reaching patterns train your core and pelvic floor to support you during everyday reaching tasks. Stand with feet hip-width apart and place an object on a surface at about shoulder height. Reach for the object with one hand while maintaining proper alignment. Don't let your ribs flare out or your lower back arch excessively. Focus on initiating the reach from your upper back rather than overextending your spine. Practice diagonal reaches as well, high to the right, low to the left, and vice versa. Throughout these movements, maintain gentle engagement of your deep core and pelvic floor. Perform 6 to 8 reaches in each direction. This exercise pattern translates directly to activities like putting dishes away, reaching for clothes in a closet, or placing objects on shelves. Proper lifting mechanics are crucial for pelvic health, as improper lifting is a common cause of increased pelvic pressure. Practice with a light object like a small box or bag. Stand close to the object with feet shoulder-width apart. Lower into a squat or half squat, depending on the object's height, keeping your back in its natural curve. Grasp the object and hold it close to your body. Exhale as you lift, engaging your pelvic floor and core. Avoid holding your breath, which increases downward pressure on your pelvic floor. For heavier objects, consider breaking the movement into stages, first lifting to a bench or chair, then to full height. Practice this movement pattern 5 to 6 times, focusing on coordinating your breath with the lift. This training directly translates to lifting groceries, laundry baskets, or children with reduced strain on your pelvic floor. Transitional movements like sit to stand are performed countless times daily and can significantly impact pelvic health. Practice moving from sitting to standing and back with intention. Start seated at the edge of a chair with feet flat on the floor. Lean forward from your hips, not your waist, shifting your weight over your feet. Engage your pelvic floor gently as you press through your heels to stand up. Reverse the movement to sit down, controlling the descent rather than just dropping onto the seat. Practice 8 to 10 repetitions, focusing on smooth control and proper pressure management. This practice builds strength for daily transitions and reduces strain during these frequent movements. The key to successful functional movement training is integrating pelvic floor awareness into these everyday patterns. With practice, this coordination becomes more automatic, providing consistent support throughout your day without conscious effort. Start by practicing these movement patterns 3 to 4 times per week for 10 to 15 minutes. As they become more familiar, focus on applying them directly to your daily activities, consciously using proper squatting technique when lifting a laundry basket, coordination during stair climbing, or awareness during sit-to-stand transitions from your office chair. Remember to breathe naturally throughout these movements. Many women unconsciously hold their breath during exertion, which increases abdominal pressure and pushes down on the pelvic floor. Instead, try to exhale during the effort phase of movements, like standing up or lifting, and inhale during the easier phases. These functional exercises are particularly valuable for women returning to activities after pregnancy or surgery, as they retrain fundamental movement patterns that protect the pelvic floor during daily life. If you've been sedentary for a while, start with just a few repetitions of each movement and gradually build up as your strength and endurance improve. Now that we've explored these 5 exercise approaches, Kegels, yoga, aerobic activity, Pilates, and functional movement training, let's talk about how to bring them all together into a balanced weekly routine that supports your pelvic health. The beauty of these exercises is that they complement each other, addressing different aspects of pelvic health from direct muscle strengthening to whole body integration. Ideally, aim to incorporate elements from each category throughout your week. Here's a simple framework to get started. Daily, brief Kegel practice 2 to 3 times per day, 5 to 10 repetitions each time integrated into your existing routine, perhaps while brushing your teeth during your commute or while waiting for coffee to brew. 2 to 3 times weekly, 20 to 30 minutes of yoga poses focused on pelvic health, either as a standalone practice or integrated into a longer yoga session. 3 to 5 times weekly, 30 minutes of low-impact aerobic activity like walking, swimming, or cycling, focusing on good posture and breathing patterns. 2 times weekly, 15 to 20 minutes of Pilates exercises for core pelvic connection, paying special attention to proper form and mind-body awareness. Throughout daily life, apply functional movement principles to everyday activities, proper lifting technique, mindful transitions, and breathing coordination during routine tasks. Remember that consistency matters more than perfection. Even 5 minutes of mindful practice is valuable, especially if it becomes a sustainable habit. As you progress, you'll likely notice improvements not just in specific symptoms, but in your overall body awareness, confidence, and comfort. It's important to recognize that while these exercises are beneficial for most women, pelvic floor issues can be complex. If you're experiencing significant symptoms like pain during intercourse, inability to empty your bladder completely, or pelvic organ prolapse that interferes with daily activities, consider consulting with a healthcare provider who specializes in pelvic health. A pelvic floor physical therapist can provide personalized assessment and treatment plans tailored to your specific needs. Many women find that joining a specialized exercise class or community focused on women's health provides both guidance and motivation. Look for classes specifically designed for pelvic floor health, prenatal postnatal fitness, or active aging for women. Online communities can also offer support and accountability as you establish these new habits. The journey to improved pelvic health is deeply personal, and progress happens at different rates for different women. Some may notice changes within a few weeks, while others might take months to see significant improvement. Be patient with yourself and celebrate small victories along the way. What matters most is that you've taken the first step by learning about these exercises and understanding how they can support your pelvic health. The awareness you're developing is powerful in itself, and the consistent practice of these movements can lead to meaningful improvements in your comfort, confidence, and quality of life. Thank you for investing this time in your health. Remember that caring for your pelvic floor is an act of self-care that benefits not just specific symptoms, but your overall well-being. I encourage you to check out our related videos for more detailed guidance on specific exercises or pelvic health topics that might be relevant to your situation. And please consider sharing this information with other women in your life. Together, we can break the silence around pelvic health issues and empower each other with practical solutions.